this to keep going through it.
Yeah, what
So
we're
this
doing
is-
is we're just shining lights on the dog, and they're lasers, they're wavelengths, and they're set at specific wavelengths to tell the cells, the mitochondria cells, what to do, and they're basically telling it to restore and repair the damage. The first set of numbers is for any kind of inflammation in the knee. The second and third set of numbers I'm going to put in is for pain in the knee joint, and the last set of numbers is for injury or trauma, any injury or trauma to that, or pain in an area. So all three are, basically at the knee because that's where her injury was.
So it's 4 sets of numbers
Four
that you
sets,
use?
four
and they're-
sets of 4 numbers
And they're very specific to the
Very
way
specific.
the light is
to the wavelength, specific wavelength
wavelength.
that I want. So they're all being told what to do. And as you can see, it's non-invasive. It doesn't hurt. It's not hot or cold. It
Just tires her. She wants
It
to
just
lay down.
no. Well, she can lay down if she,
She
wants.
wants to,
She
but
can lay down. It's okay.
Lay down. Go ahead.
You can lay down.
Lay down, pup. Come on. Lay down. Lay down.
We
I
want
know
to
you
get
wanna
that.
turn,
You can lay down.
Lay
Come
down.
on. There you go.
Good girl, baby.
There you go.
And what's her problem?
Her problem is that she probably has a partial tear in her cruciate, in her knee.
A ligament?
Cruciate ligament, ACL ligament. And a lot of athletes get that, obviously. And it's specific for a lot of jumping. Sometimes they jump and they twist their leg the wrong way.
She's a big
A
jumper.
lot of very heavy, your dog is not overweight, but a lot of heavy dogs or cats have that problem because they're overweight and so they just don't have the
Much
agility.
pressure, sure.
But sometimes it's just genetic. Some younger dogs, it's just genetic. There's a weakness in their knee. And she's already had problems with her migrating patellas. So that means there's a little laxity in the knee to start with. And what the problem is that often if it's one leg, then they start favoring the other, putting more pressure on the other, and it could happen with the other leg. So, but with a young dog that doesn't weigh a lot, it can cure itself. A fibrous capsule will get a little thicker. But stem cells is not a bad idea if you want to do that. But why don't you wait and see? Because
Yeah, I'm not John.
she's a young dog. She doesn't weigh a lot. It might just resolve on its own. Okay, so why is that still on?
So now you change the numbers
Now I'm
now
gonna
for
go
the
change the
second
numbers,
set?
right.
Okay.
Okay, so stop. Okay, good. I don't know why that light's still on. Doesn't make any sense. It should stop. That's weird. Let me just see. This connection.
There it goes.
The connection.
Yeah, it is.
It's weird.
It's because it's blinking.
I know, I see that. That's very weird. That usually doesn't happen.
Now most veterinarians do not know about this or do not use it in their practice, is that right?
Most veterinarians don't know about it, except that lately there have been a lot of articles in our journals. Like once a month, there's usually an article about lasers and how it solves some problem in a vet office. And so it's becoming more recognized and known. And I predict that within 3 years, an awful lot of veterinarians, conventional vets will have this. It's not just a holistic
Sure.
tool. It's being used by many, many conventional vets. It's very effective with horses, with small animals, and it's being very widely used. And I think it will become a very, almost everybody will have it. It's like X-ray; they'll all have it.
That would be great.
Yeah, I'm pretty sure because it's becoming so widely advertised.
Well, when you treated my cat for complete paralysis in 2 paws, he recovered within 24 hours after the first treatment. I was convinced about
Amazing.
this. Incredible.
And I've seen dogs. I have a patient that's a dachshund, an older dachshund, who was paralyzed in the back end. Went to the clinic and they told her if she didn't do surgery, the dog would never walk again. And if she did do surgery, it had a 50-50 chance.
Oh boy.
And they couldn't afford the $7,000 surgery, so they were crying, hysterical. And we just did chiropractic and laser, and the dog is walking now, doing great, chasing squirrels.
How old?
Fantastic.
Probably middle-aged dog, but waddles a little bit, but up and running.
That's wonderful.
So
Wow.
those people are very, very happy. Very happy.
That's
Oh,
great.
sure. $7,000.
Right, well, that's what these
That's
things.
everyone's problem. Yeah. It's
Well, if you
money.
don't have insurance, you're.
Yeah, but I couldn't get insurance for her because of the allergies. They
Yeah, but you could have gotten it for anything else. That would have been a pre-existing condition. They would have given you insurance for anything else.
Oh, really?
Oh,
I wonder
sure.
if I can still.
Not
No.
now. Well, now she says now this
Because
is a
of this.
pre-existing condition. I mean, you can get insurance, but they exclude certain things, or they say.
surgery.
Well, no, they exclude. Let's say if the dog has allergies, they won't pay for allergies,
no problem.
or if she has no problem for a year, maybe after that they'd consider it
Stop.
okay.
No, wait there.
Let's get a closer look at those lasers.
Can you see them? Yeah, they should.
Yeah.
They should show up good
It's
on
just a
her.
little red light.
Yeah.
Yeah, they show up good on her black fur.
So
Beautiful. You're a
you
beautiful
might
dog.
you might try, but you know
Yeah.
if you need surgery now on this, it would be a pre-existing.